Hello, I'm Dr. Robert Rushikoff from the University of California, San Francisco. Over the next few minutes, we'll be discussing several topics about diabetes. We're going to cover what is diabetes, who gets diabetes, why do we care about this problem, mainly talking about the complications, a little bit about preventing diabetes, and finally, treatment and monitoring of diabetes. So what is diabetes? The problem in diabetes is a problem of insulin. Insulin is a hormone from the pancreas. People with diabetes either have a decreased production of insulin, or the insulin that they produce just doesn't work well. The net effect of all this is glucose, or sugar, in the blood increases. When the blood sugar is high over a long period of time, the consequence of this is that people can develop complications from diabetes. The complications are divided generally into microvascular, or small blood vessel, or macrovascular, big blood vessel. The microvascular problems are eye disease, kidney disease, and nerve damage. Diabetes is a leading cause of blindness, kidney failure, and loss of limb in the United States. Macrovascular disease would be heart disease or a stroke. And people with diabetes have an increased risk of heart disease or a stroke. So how is sugar controlled? There's sugar or glucose in your blood comes from two places. It comes from what you eat, and it comes from your liver. Your liver always makes sugar day and night out of protein and fat. The sugar then ends up going to tissues throughout the body as fuel, and on this slide we have muscle as our example. Insulin comes from the pancreas. The insulin controls the liver by keeping it from making too much sugar. The insulin also helps the glucose get into cells in tissue like muscle. Now there are different types of diabetes. There's type 1, which used to be called juvenile onset diabetes or insulin dependent. There's type 2, which used to be called adult or non-insulin dependent diabetes, and several other types such as gestational diabetes, diabetes that occurs during pregnancy. When we go back to our cartoon, we can see what happens in type 1 diabetes. In type 1 diabetes, insulin is no longer produced in the pancreas. This leads to less control in the liver, and so more sugar is being produced from the liver. There's no control over getting glucose into muscle, so less glucose gets into muscle. And the net effect of that is higher sugar levels in the blood. Here we're looking at type 2 diabetes. In type 2 diabetes, we have three defects. We have a problem in the liver, where we have somewhat of a brick wall here, so the insulin doesn't work well. We have a problem in peripheral tissues like muscle. So here's our block in muscle, so the insulin doesn't work well there. In addition, just not enough insulin is being made in the liver. So we have multiple defects in type 2 diabetes. And recall, type 2 diabetes is what most people have. Probably about 95% of people with diabetes have type 2 diabetes. Now, who gets diabetes? This slide shows just how many people have been getting diabetes in the United States in the past 20 years. You can see that over the past 20 years, there's been a dramatic increase in the prevalence of obesity. This is especially true in the southeast of the United States. At the same time, the prevalence of diabetes has increased dramatically, again, increasing the most with people who are becoming most obese. So people who have diabetes generally have a genetic risk, and then because of changes in diet, in weight, and exercise, develop diabetes. If you were born in the year 2000, you have actually up to a 30 to 50% chance of developing diabetes in your lifetime. So diabetes is becoming epidemic in the United States. When we try to prevent complications and treat diabetes, there are a couple different ways to look at it. First of all, what's really the only safe way to treat diabetes? Really, the only safe way to treat diabetes in the long term is just not to develop it in the first place. So how do we go about that? We can prevent diabetes. We can prevent diabetes by having people eat right and exercise. And believe it or not, that truly works. People have shown in research studies when people who are at risk for developing diabetes get on a better diet and exercise regularly, that there's a 60% drop in the onset of their diabetes. So diet and exercise really does work to prevent onset of diabetes. What's really interesting is that we can prevent those complications we've talked about. On the left side here, you can see that that we have high levels of glucose, blood pressure, and cholesterol. On the right side, this person or our group of people with diabetes are at high risk for eye disease, kidney disease, and heart disease. What's really important is if we lower the glucose levels, blood pressure, and cholesterol, that the risk for eye disease, kidney disease, and heart disease really does decrease. Finally, how do we manage diabetes? There are 4 parts to this: diet, exercise, medications, and monitoring. The diet for diabetes is really just a healthy diet. We want people to eat a well-rounded, healthy diet that's not too high in calories. This is very individualized now. We want people not to eat junk foods and to eat healthy foods to maintain a good weight. Exercise remains a key important area for managing diabetes. There are 2 components that we want people to use: aerobic exercise, such as walking or riding a bike or swimming, and anaerobic exercise, resistance training, such as lifting weights or stretching. All of these are important to be done on a regular basis. It's important that if you are at risk for heart problems, that before starting an exercise program, you talk to your physician. Medications are used much of the time for treating diabetes. There are 3 major types of medications these days. There are oral agents or pills that are used for treating diabetes. There are non-insulin injections, so there are medications that are injected for helping control sugar that actually aren't insulin. And finally, there is insulin. All of these medications are quite effective, and when used properly, really do help control blood sugars. It's important to understand that using insulin for managing diabetes does not mean someone has failed in their control. Insulin is a key part of managing diabetes, and actually most people over time will need to take that. Of course, insulin currently is injected, but injections are really painless. We monitor people to see how their diabetes is doing. This can be done with what would be called a finger stick glucose. So we use a glucose meter, have a small drop of blood, and we can find out what the blood sugar is in just 2 to 3 seconds. We also monitor long-term management with a test called a hemoglobin A1C or HbA1c. This test correlates with how the sugar has been for the previous 3 months. And finally, it is important to keep the cholesterol and blood pressure in control, as I mentioned previously, so we monitor that on a regular basis. To sum up, glucoses can be controlled and the complications of diabetes can be prevented. Thank you.